The next part of the training will cover needle sticks, side effects, emergency management, and incident reporting. This section will cover ways to prevent needle stick injuries and what to do if you inadvertently stick your. Be sure to utilize your needle safety device. Never recap or detach used needles. Whenever possible, each person administering injections should have their own sharps container. Change out the sharps container if it gets filled, and do not use sharp containers that are overfilled. Here are two examples of needle safety devices, the Eclipse and the Safety Glide. The Eclipse safety device is activated by pushing the cover forward toward the needle until you hear and/or feel it lock. The Safety Glide has a lever arm that you push forward until the needle is completely covered. Never recap or detach a used needle. If, despite the precautions just mentioned, you do get stuck by a used needle, immediately wash the affected area with soap and water. Squeeze the area under running water until it bleeds. Notify your supervisor and follow up with your company's risk management protocol. Side effects from influenza vaccine are generally mild and last only a few hours to a few days. Injectable vaccine can cause swelling or soreness at the injection site, bleeding, or syncope, fainting. It can also have side effects of mild flu symptoms, muscle aches, low-grade fever, headache, and tiredness. Nausea, vomiting, diarrhea, or loss of appetite are also rare side effects of injectable flu vaccine. There can also be a mild rash. Flu-ish side effects can also include nasal congestion, sore throat, cough, wheezing, as well as the same systemic side effects listed for injectable vaccine. An emergency situation can occur when a patient experiences syncope or fainting, or when there is an anaphylactic reaction to the vaccine. Symptoms of syncope include paleness, being lightheaded, sweating, nausea, weakness, and dizziness. Symptoms of anaphylaxis include itching, erythema, urticaria or hives, angioedema, severe bronchospasm, shortness of breath, shock, abdominal cramping, and cardiovascular collapse. If a patient experiences an emergency, follow this procedure. First, assess and monitor the patient. Delegate someone to activate EMS if indicated, dialing 911, and have someone else notify the clinic supervisor and the public health nurse. Let EMS know that a patient is having a reaction to a flu vaccine that was just given. Use the emergency protocol and the emergency kit if needed. Locate the public health department event record for documentation. Complete the public health department event record located in the emergency kit and the adverse reporting form. Notify your supervisor, your public health nurse, and the Department of Health regional health officer. The public health nurse will notify the immunization program, both the regional coordinator and the state immunization program manager. This slide shows the Public Health Division event record form. The form is located inside the emergency kit and in the emergency protocol. Complete this form when an adverse reaction occurs, and be sure to record all the pertinent event information on the form. Here's a photo of the outside of the emergency kit, showing the supply list taped to the lid. Your emergency kit may look somewhat different from the one shown. Next is a photo of the inside of the emergency kit. This shows in detail the layout of the 3 tiers, showing bandages, alcohol wipes, a pen light, sterile gauze, tourniquets, tongue depressors, naloxone, and CPR masks in the top tier, vials of epinephrine, vials of diphenhydramine, needles and syringes, 1 cc and 3 cc in the middle tier. The blood pressure cuff and stethoscope and more CPR masks are in the bottom of the kit. Only open the emergency kit if you have an emergency. If the lock is broken, the public health nurse will have to re-inventory the entire contents. Please note that epinephrine is supplied in vials, not in pre-filled EpiPens. Print out the Department of Health emergency protocol and familiarize yourself with its content before the day of the clinic. Here are some of the possible vaccine administration errors. Vaccine was given to the wrong patient. The consent form was not signed. The incorrect dose was administered. Vaccine was administered to a patient with a contraindication to the vaccine. The incorrect vaccine was administered. Vaccine was administered via the wrong route. Vaccine was given at an incorrect interval.